Question 1. A 68-year-old male is admitted with acute exacerbation of chronic obstructive pulmonary disease, COPD, and pneumonia. The physician documents that the pneumonia is due to the COPD exacerbation. What is the correct sequencing for the principal diagnosis? A. Pneumonia, followed by acute exacerbation of COPD. B. Acute exacerbation of COPD, followed by pneumonia. C. COPD, followed by pneumonia. D. Pneumonia only. Answer: B. Acute exacerbation of COPD, followed by pneumonia. This question tests your knowledge of ICD-10-CM sequencing guidelines for inpatient coding, specifically regarding conditions related to COPD. The keyword principal diagnosis means the condition chiefly responsible for the admission. When pneumonia is documented as being due to an acute exacerbation of COPD, the exacerbation is considered the principal diagnosis because it led to the pneumonia and the patient's admission. For instance, if a patient with chronic bronchitis is admitted because their breathing worsened significantly due to an infection, the acute exacerbation of chronic bronchitis is coded first. Always remember to follow the due to or with guidelines in the alphabetic index and tabular list when conditions are linked. Question 2. A physician sees a patient for a follow-up appointment regarding stable hypertension. This patient has been seen by other providers in the same physician group practice within the last 2 years. How would this encounter be typically classified for CPTE/M coding purposes? A. New patient, because it's a follow-up. B. Established patient, because they've been seen by the group. C. New patient, because they have a stable condition. D. Established patient, because hypertension is a chronic condition. Answer: B. Established patient, because they've been seen by the group. This question focuses on the CPT guidelines for distinguishing between a new patient and an established patient for evaluation and management, E/M, services. The crucial clue is seen by other providers in the same physician group practice within the last 3 years. An established patient is one who has received professional services from the physician or another physician/qualified healthcare professional of the exact same specialty and subspecialty who belongs to the same group practice within the past 3 years. This patient meets that definition, regardless of the specific condition or type of visit. Always remember that the new versus established status is determined by the patient's prior relationship with the billing entity or group, not by the specific reason for the current visit. Question 3. During an inpatient procedure, a surgeon performs a cholecystectomy, which is the removal of the gallbladder. In ICD-10-PCS, which route operation best describes this procedure? A. Excision. B. Resection. C. Extraction. D. Destruction. Answer: B. Resection. This question assesses your understanding of ICD-10-PCS route operations, which define the objective of a procedure. The keyword removal of the gallbladder is critical here. While excision involves removing a portion of a body part, resection refers to removing all of a body part. Since the gallbladder is a distinct organ that is entirely removed during a cholecystectomy, resection is the most appropriate route operation. For example, if only a gallstone were removed, extraction might be considered, but resection is for the entire organ. Always distinguish between removing a part versus removing the entire organ when selecting route operations. Question 4. A coding professional working in a hospital needs to access a patient's medical record to assign accurate codes for billing. Which part of HIPAA is primarily concerned with the rules governing this type of access and the protection of patient health information? A. HIPAA Security Rule. B. HIPAA Privacy Rule. C. HIPAA Transaction and Code Sets Rule. D. HIPAA Enforcement Rule. Answer: B. HIPAA Privacy Rule. This question tests your knowledge of the different components of the Health Insurance Portability and Accountability Act, HIPAA. The crucial phrase "rules governing this type of access and the protection of patient health information" points directly to the HIPAA privacy rule. This rule sets national standards for the protection of individually identifiable health information by covered entities, including healthcare providers, health plans, and healthcare clearinghouses. The security rule focuses on the electronic protection of this information, while the privacy rule covers all forms. Remember, the privacy rule dictates who can access patient data and for what purpose, ensuring patient confidentiality. Question 5. A surgeon performs a complex repair of a laceration on a patient's leg. The repair involves a layered closure. According to CPT guidelines, what is an essential element to consider when coding for wound repairs? A. The type of anesthesia used. B. The total length of all lacerations repaired. C. The body area where the laceration occurred. D. The patient's age and gender. Answer: B. The total length of all lacerations repaired. This question assesses your knowledge of CPT coding guidelines for wound repairs. The keyword essential element guides you to identify the primary factors for code selection. For CPT wound repair codes, the two most critical factors are the complexity of the repair, e.g., simple, intermediate, complex, and the total measured length in centimeters of all repairs within the same complexity level from the same anatomical grouping. Anesthesia type, body area, beyond the general anatomical grouping, and patient demographics are not primary determinants for the repair code itself. For instance, if a patient has two complex lacerations on the leg, one 5 centimeters and one 3 centimeters, you would report a single complex repair code for 8 centimeters. Always remember to combine lengths of similar repairs in the same anatomical area. Question 6. A patient presents with a deep laceration on the left index finger that requires surgical repair. In ICD-10-CM, how is laterality typically indicated for injuries to paired organs or extremities? A. By selecting a code that explicitly states left or right. B. By assigning a separate code for laterality. C. By assuming the dominant side unless otherwise specified. D. Laterality is not usually specified for injuries. Answer: A. By selecting a code that explicitly states left or right. This question focuses on ICD-10-CM laterality guidelines, which are crucial for anatomical precision in coding. The core concept is that for paired body parts, such as fingers or limbs, ICD-10-CM codes often have specific characters to indicate laterality: 1-4 right, 2-4 left, and 3-4 bilateral. The keyword left index finger means you must find a code that precisely identifies the left side. For example, a laceration of the left index finger would have a different code than one for the right index finger. Always ensure you select the most specific code available, including laterality, to accurately reflect the patient's condition. Question 7. A physician orders an MRI of the knee for a patient complaining of mild, nonspecific knee pain without any clear injury or abnormal findings on physical exam. The insurance company denies coverage for the MRI. What is the most likely reason for the denial? A. The patient's deductible was not met. B. The service was not deemed medically necessary. C. The physician was out of network. D. The MRI machine was outdated. Answer: B. The service was not deemed medically necessary. This question addresses the concept of medical necessity, which is a fundamental principle in healthcare reimbursement. The critical clues are mild, nonspecific knee pain without any clear injury or abnormal findings, which suggests that the MRI may not be clinically justified for the patient's symptoms. Medical necessity means that a service or supply is appropriate and consistent with the diagnosis, in accordance with accepted standards of medical practice, and performed in the most appropriate setting. Payers often have specific criteria or local coverage determinations, LCDs, and national coverage determinations, NCDs, that define when certain services are considered medically necessary. Always ensure documentation supports the medical necessity of any billed service. Question 8. A patient undergoes an arthroscopic procedure to remove loose bodies from the knee joint. In ICD-10-PCS, which approach would typically be used to code this procedure? A. Open. B. Percutaneous. C. Via natural or artificial opening. D. External. Answer: C. Via natural or artificial opening. This question tests your understanding of ICD-10-PCS approaches, which describe how the surgeon gets to the operative site. The keyword arthroscopic is the key indicator here. An arthroscopic procedure uses a scope inserted through a small incision, which falls under the via natural or artificial opening approach because it utilizes a pre-existing or created pathway to reach the internal body part. An open approach involves cutting through the skin and other tissues to expose the body part, while percutaneous involves puncture or minor incision without visualization of the entire site. Remember that via natural or artificial opening is used for endoscopic and arthroscopic procedures. Question 9. A patient with severe sleep apnea is prescribed a continuous positive airway pressure (CPAP) machine for home use. Which coding system would be used to report the CPAP machine and its associated supplies? A. CPT. B. ICD-10-CM. C. HCPCS Level 2. D. ICD-10-PCS. Answer: C. HCPCS Level 2. This question asks about the appropriate coding system for durable medical equipment, DME, and supplies. The keyword CPAP machine for home use identifies this as a supply or piece of equipment. HCPCS Level 2, Healthcare Common Procedure Coding System, codes are used to report services, equipment, and supplies not covered by CPT codes, particularly for Medicare and other payers. CPT is for physician and other professional services, ICD-10-CM is for diagnoses, and ICD-10-PCS is for inpatient procedures. Therefore, for things like CPAP machines, wheelchairs, or certain injectable drugs, you would turn to HCPCS Level 2 codes. Question 10. A physician documents that a patient's uncontrolled diabetes is significantly impacted by their inability to afford healthy food and living in an unsafe neighborhood. How would a coder capture this information in ICD-10-CM for comprehensive patient care and data analysis? A. By selecting additional codes for the diabetes only. B. By reporting Z codes for social determinants of health, S/H. C. By using CPT codes for patient education. D. This information is not codable in ICD-10-CM. Answer: B. By reporting Z codes for social determinants of health, S/H. This question addresses the important concept of social determinants of health, S/H, in ICD-10-CM, a key area for comprehensive patient care and public health data. The keywords inability to afford healthy food and unsafe neighborhood clearly indicate social or economic factors influencing health. These factors are captured using specific Z codes, e.g., Z59.X for problems related to housing and economic circumstances, Z60.X for problems related to social environment. Reporting these Z codes provides valuable data about non-medical factors affecting a patient's health and can help inform care coordination and resource allocation. Remember to capture S/H when documented as impacting health. Question 11. A surgeon performs an appendectomy. According to CPT guidelines, what is included in the global surgical package for this procedure? A. The initial office visit where the decision for surgery was made. B. Postoperative care for 90 days following the surgery. C. Anesthesia services provided during the surgery. D. Any diagnostic tests performed preoperatively. Answer B. Postoperative care for 90 days following the surgery. This question tests your knowledge of the CPT Global Surgical Package, which bundles various services into a single fee. The Global Surgical Package includes the operation itself, local anesthesia, if used, typical postoperative care, and follow-up visits within a specified period, 0, 10, or 90 days, depending on the procedure. For a major procedure like an appendectomy, the global period is typically 90 days. Services like the initial decision for surgery, separate diagnostic tests, or services provided by other specialties, like anesthesia by an anesthesiologist, are generally not included. Always remember to check the global period definition for the specific CPT code to understand what postoperative care is bundled. Question 12. The Office of Inspector General, OIG, Work Plan is a significant tool for healthcare compliance. What is the primary purpose of the OIG Work Plan? A. To provide guidance on new CPT codes. B. To outline areas of focus for audits and investigations in the healthcare industry. C. To set reimbursement rates for Medicare services. D. To publish patient satisfaction scores for hospitals. Answer B. To outline areas of focus for audits and investigations in the healthcare industry. This question focuses on the role of the Office of Inspector General, OIG, and its work plan, which is vital for healthcare compliance. The core concept is that the OIG is responsible for combating fraud, waste, and abuse in federal healthcare programs. The OIG Work Plan is an annual list that details specific areas of concern that the OIG intends to audit or investigate in the coming year. For example, it might highlight common coding errors or questionable billing practices. Coders and healthcare organizations use this plan to proactively review their own practices and reduce compliance risks. Staying informed about the OIG Work Plan helps your organization prepare for potential scrutiny. Question 13. A patient is admitted to the hospital after falling off a ladder while cleaning gutters at home, resulting in a fractured arm. In addition to the fracture code, what type of ICD-10-CM code is essential to capture this information? A. Z code. B. V code. C. External cause of morbidity code. D. Adverse effect code. Answer C. External cause of morbidity code. This question addresses the use of ICD-10-CM external cause of morbidity codes, which provide crucial details about how an injury occurred. The keywords falling off a ladder and fractured arm indicate an injury requiring an external cause code. These codes, typically starting with V, W, X, or Y, describe the circumstances surrounding an injury or other health condition, such as the event that caused it, the intent, accidental, intentional, the place of occurrence, and the activity the patient was engaged in. For instance, W11.XXXA would be used for a fall from a ladder. Capturing external cause codes is important for injury prevention and public health statistics. Question 14. An anesthesiologist provides general anesthesia for a complex surgical procedure. CPT codes for anesthesia services are typically based on which two main components? A. Patient's age and gender. B. Surgical approach and diagnosis. C. Anesthesia time and base unit value. D. Number of medications administered and vital signs. Answer C. Anesthesia time and base unit value. This question focuses on the core components used to calculate CPT codes for anesthesia services. The keywords anesthesiologist provides general anesthesia guide you to the specific CPT section for anesthesia. Anesthesia codes are typically determined by combining the base unit value of the procedure, a fixed value assigned to each surgical procedure based on its complexity, and the anesthesia time, which is measured in 15-minute increments from the start of anesthesia until the patient is no longer under the care of the anesthesiologist. For example, an appendectomy might have a base unit of 5, and if the anesthesia took 60 minutes, for units, the total units would be 9, 5 base plus 4 time units. This calculation, along with any applicable modifying units, determines the final reimbursement. Question 15. When abstracting information from a patient's medical record for coding purposes, what is the primary goal of the coder? A. To ensure all services result in the highest possible reimbursement. B. To extract all relevant data to assign accurate and complete codes. C. To identify potential legal issues or malpractice claims. D. To summarize the patient's entire medical history for administrative staff. Answer: B. To extract all relevant data to assign accurate and complete codes. This question addresses the fundamental process of medical record abstracting for coding. The keyword primary goal indicates the most important objective. A coder's main responsibility when abstracting is to meticulously review the entire medical record, physician notes, operative reports, pathology reports, etc., to identify and extract all diagnoses, procedures, and services that are clinically supported and meet coding guidelines. This ensures that the assigned codes accurately reflect the patient's condition and the care provided, which in turn supports proper billing, data analysis, and quality reporting. It is not about maximizing reimbursement, but about accurate representation. Question 16. A patient is seen for rule-out appendicitis based on abdominal pain and tenderness. After observation, the physician documents that appendicitis was ruled out and the patient was discharged. How should the rule-out appendicitis be coded in an outpatient setting? A. Code appendicitis as if it were confirmed. B. Code the presenting symptoms, e.g., abdominal pain. C. Do not code anything for the rule-out diagnosis. D. Code AZ code for observation for suspected condition. Answer: B. Code the presenting symptoms, e.g., abdominal pain. This question tests your understanding of ICD-10-CM guidelines regarding uncertain diagnoses or rule-out conditions, specifically in the outpatient setting. The key phrase "ruled out" in an outpatient encounter is crucial. Unlike inpatient coding where a rule-out diagnosis may be coded as if it exists if it's still uncertain at discharge, for outpatient encounters, you should never code a diagnosis that is documented as rule-out, possible, probable, or suspected unless it is confirmed. Instead, code the signs, symptoms, or abnormal findings that led to the encounter. For example, in this case, you would code abdominal pain, R10.9, rather than appendicitis. Question 17. A patient undergoes an MRI of the brain with contrast. The radiologist performs the interpretation and prepares a written report. In CPT, how is the professional component of a radiology service, like this interpretation, typically distinguished from the technical component? A. By adding a specific modifier, -26 or TC. B. By using a different CPT code for each component. C. By documenting it in a separate section of the medical record. D. The components are always bundled into one code. Answer: A. By adding a specific modifier, -26 or TC. This question addresses the coding of radiology services, specifically the separation of professional and technical components. The key clue is radiologist performs the interpretation and prepares a written report, which represents the professional component. CPT uses modifiers to distinguish between the professional component, -26, e.g., the radiologist's supervision and interpretation, and the technical component, TC, e.g., the equipment, film, and technologist services. When a physician owns the equipment and performs the service, a global code is used. For example, if a radiologist only reads an MRI performed at another facility, they would append modifier -26 to the CPT code. Always remember these modifiers for proper billing of shared services. Question 18. A coder identifies that a patient had a knee arthroscopy, CPT code 29874, and a separate knee MRI, CPT code 73721, performed on the same day. The coder then checks the National Correct Coding Initiative, NCCI, edits. What is the primary purpose of NCCI edits? A. To determine if the services are medically necessary. B. To identify improper payment from unbundling or incorrect coding combinations. C. To set the reimbursement rates for Medicare services. D. To verify the patient's insurance eligibility. Answer: B. To identify improper payment from unbundling or incorrect coding combinations. This question focuses on the purpose of National Correct Coding Initiative, NCCI, edits, which are crucial for compliant coding. The primary purpose of NCCI edits, created by CMS, Centers for Medicare and Medicaid Services, is to prevent improper payments due to unbundling of services or incorrect reporting of mutually exclusive procedures. They define pairs of codes that should not be reported together or that one service is integral to another. For example, a minor procedure might be bundled into a more extensive one. If codes are bundled, you might only bill the comprehensive code or use a modifier if a specific circumstance allows. Always review NCCI edits to ensure proper code combinations. Question 19. A patient undergoes a colonoscopy. In ICD-10-PCS, which body system is primarily associated with this procedure? A. Gastrointestinal system. B. Genitourinary system. C. Cardiovascular system. D. Nervous system. Answer: A. Gastrointestinal system. This question assesses your basic understanding of anatomical body systems as categorized in ICD-10-PCS. The keyword colonoscopy directly points to the colon, which is part of the large intestine and, therefore, the gastrointestinal system. ICD-10-PCS codes are structured with the first character defining the medical and surgical section, and the second character typically indicating the body system. Recognizing common procedures and their associated body systems is foundational for accurate PCS coding. For instance, a kidney procedure would fall under the genitourinary system. Question 20. A 5-year-old child presents for a well-child checkup, including age-appropriate immunizations. What type of CPTE/M service would this typically be coded as? A. Office visit for an established patient, 9921X. B. Office visit for a new patient, 9920X. C. Preventive medicine services, 9938X or 9939X. D. Counseling and risk factor reduction intervention, 9940X. Answer: C. Preventive medicine services, 9938X or 9939X. This question tests your knowledge of CPTE/M categories, specifically for routine checkups. The keywords well-child checkup indicate that the service is preventive in nature, focusing on health maintenance rather than managing an acute or chronic illness. CPT provides specific codes for preventive medicine services, 99,381 to 99,397, based on the patient's age and whether they are new or established. These codes include the age-appropriate history, examination, counseling, and anticipatory guidance. For example, a routine physical for an adult would also fall under this category. Remember to distinguish between problem-oriented visits and preventive health services. Question 21. A Medicare patient is scheduled for a diagnostic test that the physician believes may not be covered by Medicare. To ensure the patient is aware of their potential financial responsibility, what document should the physician have the patient sign before the service? A. Assignment of benefits. B. Explanation of benefits, EOB. C. Advance Beneficiary Notice of Non-Coverage, ABN. D. Consent for treatment. Answer: C. Advance Beneficiary Notice of Non-Coverage, ABN. This question addresses the important compliance tool known as the Advance Beneficiary Notice of Non-Coverage, ABN. The key clue is that the physician believes the test may not be covered by Medicare and wants to inform the patient of their potential financial responsibility. An ABN is a written notice from Medicare providers to Medicare beneficiaries indicating that a service or item may not be covered by Medicare. It allows the beneficiary to make an informed decision about receiving the service and accepting financial responsibility if Medicare denies payment. Without an ABN, the provider may be held financially responsible if Medicare denies the claim. Question 22. A patient is admitted to the hospital with severe abdominal pain, vomiting, and dehydration. After extensive workup, the final diagnosis at discharge is acute pancreatitis. What is the correct principal diagnosis for this inpatient admission? A. Abdominal pain. B. Dehydration. C. Vomiting. D. Acute pancreatitis. Answer: D. Acute pancreatitis. This question assesses your understanding of the principal diagnosis selection for inpatient hospital admissions. The crucial concept is that the principal diagnosis is the condition, determined after study, that was chiefly responsible for the patient's admission to the hospital. While abdominal pain, vomiting, and dehydration were the symptoms that led to the admission, acute pancreatitis is the definitive diagnosis that explains those symptoms and required the inpatient care. For instance, if a patient is admitted with chest pain and after tests, a heart attack is diagnosed, the heart attack is the principal diagnosis. Always select the condition that most accurately reflects the reason for the admission after all studies are completed. Question 23. A physician orders a basic metabolic panel for a patient. In CPT, how are laboratory panels, like the basic metabolic panel, typically coded? A. By coding each individual test within the panel separately. B. By selecting a single CPT code that represents the entire panel. C. By coding only the most expensive test in the panel. D. Laboratory panels are not codable in CPT. Answer: B. By selecting a single CPT code that represents the entire panel. This question pertains to CPT coding for laboratory services, specifically the concept of panels. The keyword basic metabolic panel indicates a group of tests defined by CPT. When CPT defines a panel, e.g., basic metabolic panel, comprehensive metabolic panel, lipid panel, a single CPT code exists for that entire group of tests. You should not unbundle these panels and report individual tests if all tests within the panel were performed. For example, CPT code 80047 covers the basic metabolic panel, which includes 8 specific tests. Always refer to the CPT codebook to ensure all required components of a panel are performed before assigning the panel code. Question 24. A patient undergoes a surgical procedure where an incision is made to explore a body cavity. The medical term for incision into a body cavity often ends with which common suffix? A. Ectomy. B. Plasty. C. Otomy. D. Ostomy. Answer: C. Otomy. This question tests your knowledge of common medical terminology, specifically suffixes related to surgical procedures. The keywords incision is made and explore a body cavity point to a cutting or incision action. The suffix otomy consistently means incision into or to cut into an organ or body part. For example, a tracheotomy is an incision into the trachea, and a laparotomy is an incision into the abdominal cavity. In contrast, ectomy means surgical removal, plasty means surgical repair, and ostomy means creating a new opening. Understanding these common suffixes is fundamental for interpreting medical documentation. Question 25. The False Claims Act is a significant piece of legislation in healthcare compliance. What is the primary purpose of the False Claims Act? A. To regulate patient privacy in electronic health records. B. To prevent and prosecute fraud against the government, especially in federal healthcare programs. C. To establish standards for medical education and licensing. D. To ensure fair billing practices for commercial insurance companies. Answer: B. To prevent and prosecute fraud against the government, especially in federal healthcare programs. This question focuses on the False Claims Act, a cornerstone of healthcare compliance. The key phrase, fraud against the government, especially in federal healthcare programs, highlights its core purpose. The False Claims Act, FCA, imposes liability on persons and companies who defraud governmental programs, including Medicare and Medicaid, by knowingly submitting false or fraudulent claims for payment. Examples include billing for services not rendered or upcoding to a higher level of service. It also includes CPT provisions, allowing whistleblowers to file lawsuits on behalf of the government. Understanding the FCA is vital for coders to avoid contributing to fraudulent billing practices.